Waihape mai, welcome back. A report released exclusively to Newshub Nation by the Helen Clark Foundation has found that half of all new mothers in Aotearoa, New Zealand experience mental health distress, and the leading cause of death among pregnant wahine women in Aotearoa is suicide. The author of the report is former Green MP Holly Walker, who left Parliament in 2014 after herself suffering postnatal depression. She's now the Deputy Director of the Helen Clark Foundation and joins us this morning to talk about her report findings. Holly, tēnā koe, welcome to the program. Some pretty shocking findings indeed. Suicide, the leading cause of death amongst pregnant women in Aotearoa. Why?
Well, look, yes, you're right. It's shocking. It's very confronting and distressing findings. You know, I think as any parent will tell you, that period of time, we call it the perinatal period, it's from conception until the baby's first birthday. You know, it's a joyful, wonderful, amazing time when you've got a new pepe, a new baby in your whānau, but it can also be very stressful, very challenging and very overwhelming for whānau and for new mama and birthing parents.
Absolutely. Māori women also 3 times more likely to die this way, by way of suicide. What's going on?
Yeah, it's a really shameful finding, isn't it? You know, I think for many parents, this, as I said, this period of time can be very challenging and overwhelming. You know, traditionally in Te Ao Māori, birthing mama and pepe would have been surrounded by whānau collective support. You know, there's lots of cultural practices from Te Ao Māori and Pacific cultures and many cultures around the world actually that understand that this is a time when people need support and need to be surrounded by family and been taken care of. But I think increasingly in our modern world, that is very difficult. It's difficult to take care of whānau if you yourself are struggling, if you're on a low income, if you're in unstable housing, you know. So not only for the parents themselves, but for their wider support networks, they may be breaking down and it may be more challenging to provide that collective support to people. So when parents do find themselves isolated, find themselves lacking support, lacking sleep, you know, with a new baby, very overwhelmed, it can quite quickly lead to quite severe experiences of anxiety, depression, and in serious cases, psychosis, self-harm and suicide. You know, the numbers are relatively small in total numbers of deaths by suicide, but...
Yeah, what are we talking? What are the numbers?
So we're sort of talking in the tens per year in Aotearoa, New Zealand, but when you take it as a percentage of the population or as a rate, our suicide rate is 7 times higher than that in the UK, yet we have very similar maternal mortality rate to them on every other measure. So we're clearly getting something very wrong here.
Holly, the research is really close to your heart. I mean, you yourself have suffered postnatal depression as well as self-harm. Can you share a bit about your experience?
Yeah, so I had my first daughter while I was still a Member of Parliament. And look, I know lots of MPs have done that since, including the Prime Minister, and it's wonderful that that's something that more MPs are doing. For myself personally, I found it very challenging, and I think I lacked the knowledge or the experience or the language to really understand what was going on for me in terms of mental health, because it was my first baby and I thought perhaps this is just a normal amount of sleep deprivation or a normal level of stress to be experiencing. So it kind of crept up on me in many ways. And I was someone with a huge amount of privilege, you know. I'm a Pākehā woman, I'm able-bodied, I was in a very, you know, had a good income, secure housing, and yet, you know, it was extremely distressing and I had a really challenging experience. So that's part of what motivated me to write this report, is understanding that, you know, up to half of all new birthing parents in Aotearoa, New Zealand at the moment are experiencing symptoms of depression and anxiety. And it's not only very challenging for them as individuals, but it can have very serious consequences for their baby, for their whānau, for their intergenerational well-being as well. So if we prioritise this issue more as a public policy issue and invested more in perinatal mental well-being, we could make a real difference for whānau and communities.
Yeah, leads me to my next question. Associate Health Minister Aisha Verrill has seen this report. What's the one thing I know that's really difficult, but one thing that's pressing for the government that you would recommend the government take up right now and do?
Well, look, we're about to have a major transformation of our health system. You know, on the 1st of July, we'll have a new Health New Zealand agency and a new Māori health agency. What I would love to see is the issue of perinatal mental wellbeing being really high on the agenda and a top priority for that new transformed health system.
Because to date, what has the government done in terms of supporting mothers or focusing purely on maternal mental health?
Look, I think there's some really good indications that this is an area that the government does want to take seriously, and often we view it through that lens of child wellbeing and child and family poverty, for example. So we've got a child and youth wellbeing strategy, we've got a maternity action plan, we've got a breastfeeding plan, but none of those things are coming at this issue through that lens of the birthing parents' mental well-being. And actually, I think when you look at it through that lens, the solutions become really clear. It's not a narrow issue. It's about big picture causes as well, things like housing, income, parental leave, domestic violence, all of these things are very linked. But viewing it through the lens of the parents' mental well-being sort of unlocks the supports that are required to really make a difference.
Why is it a really important issue right now?
So I think there's a number of reasons. First of all, you know, as we've said, up to half of birthing parents may already be experiencing these things with consequences for their children. You know, the COVID-19 pandemic has not helped. It's early days in terms of documenting the impact of that, but certainly the early indications are that it's had a detrimental effect. And also we probably have a cohort of young people who are going to become parents in the next 5 to 10 years who are already experiencing high rates of mental health challenges, disproportionately high in that younger age group. And we know that having had a previous experience of mental illness is a significant risk factor for developing perinatal distress as well. So we need to anticipate that coming challenge for that next generation of parents and act now to be ready for that as well.
Your report highlights poor housing, low income, intergenerational factors, which you've explained in this interview. Can this even be tackled through the health system?
No, I mean, the health system is key, and I think that overall overarching recommendation we have of prioritising it in the new health system is important. But many of the drivers of this issue are structural, systemic things. And so I think we need to be thinking about what we can do at that level as well to improve the situation for whānau in general. And so that is things like access to affordable, high quality, stable housing. It's things like the Te Aotearoa strategy to address intimate partner and sexual violence. I think we should look at extending parental leave to include the non-birthing parents as well, because anything we can do to surround parents with support at that really critical time at the start of a baby's life will make a huge difference.
Thank you very much for joining us this morning.
Thanks
Holly
for having me.
Walker, tēnā koe.
Well, Holly Walker there. Dr.